Coronary angioplasty is a medical procedure used to treat coronary artery disease, which is the narrowing or blockage of the arteries that supply blood to the heart muscle. During angioplasty, a thin, flexible tube called a catheter is threaded through an artery in the arm or leg and guided to the blocked artery in the heart. Once the catheter is in place, a small balloon at the end of the catheter is inflated to widen the narrowed or blocked artery, restoring blood flow to the heart. In some cases, a stent, a tiny mesh tube, may be placed in the artery during angioplasty to help keep it open. This is called a stent implantation or percutaneous coronary intervention, PCI. Coronary angioplasty is a minimally invasive procedure that is typically performed under local anesthesia, and it usually takes about an hour to complete. It is a common and effective treatment for coronary artery disease, and it can help relieve chest pain, improve heart function, and reduce the risk of heart attack. However, like all medical procedures, there are risks associated with coronary angioplasty, including bleeding, infection, and damage to the artery or surrounding tissues.